I just wanted to take a minute and try and explain Medicare in a way that people could understand and repeat by themselves at home, and hopefully just get a better understanding of what it is. So Medicare has four parts. I think everybody knows this, right? There is Part A, and Part A costs $0 and 0 cents. It is for hospital visits. Part A is going to happen on your 65th birthday, like it or not. It's just going to happen. You don't have to sign up for it. You don't have to do anything. You're just going to get it. Part B, in the year 2020, is $144.60 and is for doctor visits. Usually, this $144.60 is taken out of Social Security. Now, not everybody takes Social Security at 65, so it could be 66 to 67. But if you decide to take Medicare at 65 years old, they will not take it out of your Social Security. If you're not taking Social Security, they will send you a bill quarterly. So $144.60 times 4 in order to get their quarterly amount. Some things you should know about your Part B. First, if you have made more than $100,000 a year during your working years, right, your Part B will be more than $144.60. If you are making less than $1,200 a month in your retirement, then that $144.60 can go down all the way to 0. Third thing, right? Part B is an election, which means you have to choose to get it. I kind of say it's like breathing. You don't have to, but if you don't, there's dire circumstances. For anyone who does not get Part B when they turn 65, will pay a penalty for every month they did not have Part B when they were supposed to for the rest of their life, with one exception. If you are still working for a company with more than 20 employees, then you can defer Part B and keep your work insurance until you actually are not working anymore. That's very important. Okay. Then we have Part C. No one calls it Part C. Part C is for miscellaneous. It's anything that is not a hospital stay, doctor visit. So x-rays, lab work, hospital stays, emergency rooms, ambulance rides, surgeries, everything else, right? And there is a range in cost between $0 a month to $255 a month. I'll get more into that a little bit later. And then there is Part D, which most everyone is familiar with. And this ranges also from $0, but up to about $80 a month. And this is for prescriptions. These are the four parts, A, B, C, and D, that make up Medicare. Again, Part A, you are going to get automatically. Part B, you have to choose to get. You cannot get Part C and Part D until you already have Part B. So Part B is very important. All right. Now, a little bit more explanation. I'm going to stay right here and say all of these things here above my line. This is the same across the entire United States. Nothing really changes, right? So I'm going to slide down here and say there are 3 ways. There are truly 6 different ways, but we're going to talk about 3 specific ways to get Medicare, at least the average person. Okay? One way is through group Medicare. these are the people who worked at Kodak or Xerox or a school district. And when they retired, they were going to get their Medicare thrown in with their retirement plan. These are the most expensive ways to get Medicare, and you can only get them through them. You can't get them through someone else. So if you're looking for group Medicare, if you work at a school district and you want to get that way, all right, you have to talk to the people at the school or at the group or at Kodak or Xerox. Again, it's the most expensive way, and you can probably get a cheaper or a less expensive plan that covers the same thing another way. So we're not going to talk about these at all. Way number 2 is where about 80% of my clients fall in, right? And they are MAPD. It stands for Medicare Advantage with Part D. That means is they take D and C and B and A and they roll it all into one card, right? These are designed by the carriers. Okay, and I'll get more into that in a little bit. Then there is the third way. Third way we call Medigap or MedSup, Medicare Supplemental Plans, right? And these are government designed. All right, what do I mean by that? Let's take this line down here. Take this line down here. All right. When you are looking, and I'm actually going to get rid of this because we're not talking about these anymore. All right. When you are looking at plans, there are 3 things that you're going to want to consider. Number 1, you're going to want to consider plan benefits. Number 2, you're going to want to consider plan network. And then number 3, you're going to consider the actual plan cost. I'm going to see if I can give you a little bit more information on those. Number 1, plan benefits. This is basically, what does the plan have? How much does it cost for me to go to the doctor? How much does it cost for me to go to a specialist? What's my emergency room, right? What if I have to get surgery, right? In the greater Rochester area, we have 32 different plans. So these 32 different plans, and we're talking from everybody. We're talking from Blue Cross Blue Shield, Univera, Aetna, United, AARP, Fidelis, and so on and so on and so on and so on. All 26 different ones. And this is the part where I'd like to remind people, I'm a broker, which means I represent every single company that sells health insurance in all of New York State, all 26 of them. And if you choose a plan that costs $0 a month, or if you choose a plan that costs $255 a month, I get paid $25 a month. So I don't care which plan you choose. I get paid exactly the same. It benefits me better to help you choose a plan that you like, so we can do it again the following year. Okay? So plan benefits. There are 32 different plans. Right? And that's why I wrote up here carrier designed, because the carriers, Blue Cross Blue Shield, Univera, Aetna, United, AARP, they design the plans to make them attractive for you to buy. Okay? Over on the right, the government design plans, right? What that means is all plans, regardless of carrier, are the same. So if you get a plan F, a plan N, a plan G, because they use letters in their plans in the government, they're going to be exactly the same. So if you get a Blue Cross Blue Shield plan F and you get an AARP plan F, same benefits, same cost, still this much to go to the doctor. It can't change because the government makes the rules and how they design the plans. Right? That might not be comforting, knowing that our government does things the way they do, but at least it takes off which plan is better. You just choose a letter. and you don't care which one you go with. Right? Now we're going to go with plan network. This is where you want to talk to me about HMOs and PPOs and POS programs, right? This is my doctor in network. If I choose an HMO, that means I can only go to HMO doctors. That is true. Blue Cross Blue Shield is an HMO, and you can only use Blue Cross Blue Shield doctors. Thankfully, in the greater Rochester area, Blue Cross Blue Shield has 99% of the doctors. So you'd have to work really hard to find a doctor that Blue Cross Blue Shield doesn't take. On the other hand, United does not have all of the doctors in the greater Rochester area. They have more like 50%. Last year, Strong took United, but RGH and Unity did not. So you have to worry about your plans in there. Right? And that's in the middle ground, right? Under these MAPDs. You have to talk about those things, your plan networks. Also, you want to talk about, can I travel? If you're spending 4 months a year in Florida, or it seems like nowadays Florida is Arizona, if you're spending time in Arizona or you're spending time in Florida, right? The plans might not travel with you. So you want to see, do some do that, do some not. Those are questions that are good there. Under the government plans, right, the Medigap plans, right, it is every doctor in the USA that takes Medicare. So you can go down to MD Anderson down in Texas, you can go to the Cleveland Clinic, the Mayo Clinic, you can go anywhere you want to go. This plan travels. Okay? Now, plan costs. We talked a little bit about this before, but when it comes to the MAPD plans, right, you want to look at monthly costs versus doctor costs. On the government plans, you want to look at doctor costs versus monthly cost. I'm going to try and explain how this works. Right? And I'm going to choose a plan. I'm not going to tell you who the plan's from. I'm just going to use it as an example. Right? So when we look at the cost of a plan, let's take a look at the primary care physician, the specialist cost, the emergency room, inpatient hospital. That means staying inside the hospital for more than 24 hours. So actually overnight in the hospital, an ambulance ride. We can look at outpatient, and we can look at physical therapy or any kind of therapy, right? These basic costs, right? Now, on a MAPD plan that costs $0, right? So the monthly cost is $0 a month. The doctor cost would be $15. A specialist would be $50. Emergency room would be $90. Inpatient for 24 hours is actually $380 a day for days 1 through 5, and $0 a day for day 6 to day 90. The ambulance ride is $150. Outpatient, right, would be about 20% of the outpatient cost. Physical therapy is going to be about $40. Okay, so this is the regular cost and how that's going to go. So again, $0 a month, but these are the co-pays every time you go to the doctor, all the way down. On the government plan, the med subs, you could be paying $230 a month, right? 0 versus 230, it's a big difference. But you pay $0 to go to the doctor, $0 to go to the specialist, 0 for the emergency room, 0 for the hospital stay, 0 for the ambulance, 0 for outpatient, and 0 for physical therapy. So you can see how this adds up. Now, I want you to take a look at this, right? And this is how I try to help most people out. I'm going to slide down here a little bit and say, okay, let's just say you're going to have one surgery, knee replacement, a hip replacement, something along those lines, right? You're going to have to go to your primary care physician at least once in order to go to your specialist. That doesn't always happen, not in every plan. I'm just using this as an example. Okay? So 15 times one visit is $15. Then, if you're going to have that knee replaced, you're going to have to see your specialist probably 4 times. The first time to say you have a problem, the second time for them to take the x-rays, review the x-rays with you, right? The third time for pre-operation, fourth time for post-operation. That's minimum. I'm sure it's going to be more than 4 visits, but we're going to say 4, right? So times 4 visits, that's $200. Okay? We're hoping there'll be no emergency room visits, 0. Right? If you have that surgery, you're minimum going to spend 2 to 3 days in the hospital. I'm going to say times 3. I'm going to call 380 400 just for easy math. So there's 1,200. Right? Ambulance ride, we shouldn't need any of those. 0. Outpatient surgery, 0 because this is going to be an inpatient surgery. So there's going to be no cost for that. But you're going to have to go to the physical therapist probably about 10 times. Times 10, so 400. All right, so we say 400, 1,200, 1,600. 1,600 and 200 is 1,800. So we're going to say $1,815 minimum, right, to have a surgery, a knee replacement, a hip replacement on the MAPD plan that costs you $0 a month. Right? On the plan on the right, we take $230 a month times $12, or times 12 months, 12 months. 12, 0, 6, 4, and then 230, 0, 6, 7, 2. So on this plan, you spend $2,760 a year, even if you never went to the doctor once. On the MAPD plan, you would spend $1,800 on just one surgery. So I always tell people to use $2,600 as a basis of what to start with. If you plan on spending $2,600 a year going to the doctor, right? That's primary care physicians, specialists. If you see 2 specialists a month, right? You figure 2 specialists. Change my color here. 2 specialists times twice a month. That's $100. That's $1,200 a year just in specialist costs. Right? I don't know if you go to the emergency room. I don't know about hospital stays. I don't know about ambulance. Those are kind of all out there. Right? But this is usually where people spend most of their money. Right? That's half of here. You're still saving quite a bit of money by staying there. And this is what I want you to know. This is probably the most important thing. I can move you from this $0 plan to, I can move you from the $0 plan to the $230 plan anytime I want during the year. So you can have $0 January, February, March. In March, you find out you have to have hip surgery, and then in May, or April, May, I can move you to the $230, and then it's not $230 a month, it's just $230 from May until the end of the year, because I cannot take you back anytime I want. So I can move you from the MAPD plan, MAPD right there. I can move you from MAPD to Medigap anytime during the year I want. Now again, if you had a heart attack and you're riding in the ambulance, you cannot call me in the ambulance on the way to the hospital and say switch my plan. It only takes place in the first of the month following the month in which you want it to have happened, even if it's on the 31st. So this isn't like the save-all if you're having a heart attack or having a stroke. This is, hey, I have a planned surgery. There's something coming up that I can take a look at. All right, I want to save some money. Then I can do it. But then you have to stay on the Medigap plan until December 31st of the following year, and in January you can go back to the $0 plan. There's no problems with pre-existing conditions. That doesn't happen in New York anymore. Okay? All right, and these are things that you can ask me more specifically about your case. I just wanted to give you kind of the heads up. Now, last thing, just in summary, and then we'll be done. So you get the idea. Part A, $0. Part B, $144.60. Part C, you can say is $0. Part D, also $0. So you'd be spending $144.60 a month for what I consider pretty good coverage. Or we say $0.00 for Part A, $144.60 for Part B, $230 for Part C if you do the Medigap plan that's up here, right? And then probably $14 for your Part D. 0, 60, 8, 7, 8, 3. So you can spend $144 a month or $388 a month, right? This is plus doctor visits. This one is for the year, right? Plus prescriptions. Doesn't count prescriptions. All right. I hope that kind of gives you a better understanding. If you do have questions, please reach out to me at 585-210-3168 or Pat at hisfoundation.info. Thanks.